Health Canada has rubber-stamped another novel mRNA booster, and here's what you need to know about the looking like it's unproven shot.
We will have enough supply of the updated COVID-19 vaccines to support immunization programs across Canada. So I do think now is the time to get your masks ready if you don't already have them.
Tamara Ugolini here with Rebel News to bring you the recent Health Canada announcement that they have authorized the new Moderna Spikevax COVID-19 injection targeting the Omicron XBB.1.5 subvariant for those aged 6 months and up.
We've authorized this vaccine for people 6 months of age and older.
But what data did they use to justify this authorization? Stay tuned because we will get to that in just a minute. But first, Chief Medical Officer at Health Canada, that's Dr. Supriya Sharma, and Canada's Chief Public Health Officer, that's Dr. Theresa Tam, took center stage with 3 other masked and socially distanced health overlords to make this announcement on September the 12th, after a brief land acknowledgement.
Before I begin, I'd just like to acknowledge that Canada is the homeland of First Nations, Inuit, and Métis people, and that we are gathering in Ottawa on the unceded traditional territory of the Algonquin and Anishinaabe people.
Tim endorsed the new mRNA booster for those aged 6 months and up. Here, have a listen.
With today's authorization, NACI is reaffirming its guidance on the use of COVID-19 vaccines this fall. NACI recommends authorized age groups get an updated COVID-19 vaccine dose this fall, 6 months after their last vaccine dose or infection. We will have enough supply of the updated COVID-19 vaccines to support immunization programs across Canada. The Omicron variant continues to evolve, with XBB subvariants such as EG.5 continuing to circulate in Canada and globally. Canada has also reported 11 cases of the Omicron subvariant BA.2.86. This improved immune response is expected to better protect against the strains that are circulating in our communities. It has been more than 6 months since your last dose of COVID-19 vaccine or your last infection, your protection from the virus may have waned. Receiving a COVID-19 vaccine dose this fall with an updated formulation is expected to increase individual protection against infection, symptoms, and severe disease. This is particularly important for people at increased risk of severe outcomes, such as people 65 years and older, individuals with underlying medical conditions, pregnant people, and those living or working in congregate living settings. Vaccination, in combination with personal protective measures, are integral tools to reduce the negative impact of respiratory illnesses. This is especially important as we head into the colder months, when people spend more time indoors and the risk of respiratory illness increases.
The panel is asked why they're not using the term booster. And that is apparently because there is a global effort to standardize and simplify the terms around the now seasonal shots. Check it out.
You don't have the word booster here. I wanted to know, is that intentional, and are you wanting Canadians to change the way they look at getting the COVID vaccine?
I think we wanted to emphasize this is an updated COVID-19 vaccine. And similarly, we update influenza vaccines as well. And it will increase, getting an additional dose will increase your immunity, antibody levels, and also increase vaccine protection against serious outcomes. It's a matter of terminology, but I think we're trying to standardize and simplify some of the various terms at the moment. I know perhaps Dr. Sharma has a take on that, and Dr. Tunis as well.
Yeah, thank you, Dr. Tam. So yes, there's been lots of discussions amongst regulators around terminology. And so there's an internationally agreed upon simplified dosing schedule now. So we won't see the words primary series as much or booster. And it's not quite stabilized yet, but the idea is that we'll get to a place where It may be much like the flu vaccines, where people may be on a regular schedule getting an updated vaccine. And so really, I think there's more benefit just talking about the latest vaccine or the updated vaccine rather than going back to years ago when we were talking about your very first 2 doses or speaking about boosters. I don't mind the word booster because it actually does talk about what the vaccines, additional doses of the vaccines do for the immune system.
Of course, the masked and distanced pharma preachers warn Canadians to be mindful of their sources of information, which can be false and exaggerated.
Health Canada continues to use rigorous and independent scientific processes to ensure all health products meet our stringent requirements for safety, efficacy, and quality before allowing them on the market. And as with all of Health Canada's vaccine and drug authorizations, we want to stress that we only examine the most robust scientific evidence from trusted and reliable sources. We recognize that there's an abundance of information available that's sometimes false and exaggerated. We encourage people to consider their sources of information very carefully. As we did with all our COVID-19 vaccines, we're publishing a number of documents about this decision, including the Canadian Product Monograph and the Regulatory Decision Summary, which provides a high-level summary of the evidence that we reviewed. All of this information is available on the Government of Canada's main COVID-19 website. Health Canada and the Public Health Agency of Canada will monitor for any adverse events in collaboration with the provinces and territories, international partners, and manufacturers. As with all vaccines, we will take action if any new safety issues are identified. Today's authorization provides people in Canada with more protection against COVID-19. I know we all wish COVID-19 no longer existed, but people are still getting infected, and vaccination continues to be one of the most effective ways to protect ourselves against serious outcomes, including severe illness, hospitalization, and death. Vaccine protection decreases over time, which means many of us are due for another dose. Receiving a shot of the new formulation will help protect people against the variants circulating currently and expected to circulate through the fall and winter.
Now, it's important to note that this updated endorsement comes after Health Canada said that they reviewed safety data months before it was released. The media contact even told me that they were sending my request for clarification around this all the way up to Minister Duclos' office, but he never responded. And my follow-up question just a few weeks ago also fell on deaf ears. A year ago, I reported that scientific inconsistencies abound within the agency and its affiliates. That's the Public Health Agency of Canada and the National Advisory Committee on Immunization, otherwise known as NACI, when they told Canadians that COVID vaccines could be administered concurrently, that is, at the same time as other vaccines, which directly contradicted the manufacturer's own product monographs. So here is what the Government of Canada says about its own regulatory decision to authorize Spikevax XBB 1.5. The dose and dosing regime for Spikevax has been updated to reflect an internationally agreed upon simplified schedule. The recommended dosing regime is proposed to be 2 doses for children aged 6 months to 4 years who were not previously immunized, and 1 dose in children who have been immunized. Individuals over 5 years receive 1 dose, regardless of immunization status, at an interval of at least 6 months following the last dose. The safety, reactogenicity, and immunogenicity of Spikevax XBB 1.5 are evaluated in an ongoing Phase 2/3 open-label study in participants 18 years of age and older. So how was it studied in those under the age of 18? Well, it wasn't. The safety and effectiveness of Spikevax XBB 1.5 for individuals 6 months of age and older is referred from studies of a primary series and booster dose of Spikevax bivalent, the original/Omicron BA.1, in individuals 6 months to 5 years of age, a booster dose of Spikevax bivalent, the original/Omicron BA.1, in individuals under 18 years of age, as well as data from studies which evaluated the primary series and booster vaccination with Spikevax original. In the study of those 18 and older, there was an embarrassingly small sample size, a mere 101 people with no placebo. Look at this. In study mRNA-1273-P205, Part J, 50 participants received a 50 microgram dose of Spikevax XBB 1.5, and 51 participants received a dose of an investigational bivalent vaccine, that's XBB 1.5/Omicron BA.4/5. So a total of 101 participants were injected with the Spikevax XBB 1.5 and an investigational bivalent shot. According to the National Institute of Health's clinical trial data website, this study isn't even estimated to be completed until November 17th of this year, 2023. How can Health Canada make these claims and assertions? Surely I have to be misunderstanding something, which is why I reached out to Health Canada to ask. How many participants were included in the mRNA-1273-P205 Part J? Was it a randomized placebo-controlled safety study? And if not, how can Health Canada make safety or efficacy assertions to Canadians? What is the estimated study completion date for mRNA-1273 Part J? And when does Health Canada expect to receive that data? And this is how Health Canada Media Relations line responded. Hello, please review. Health Canada authorizes Moderna COVID-19 vaccine targeting the Omicron XBB.1.5 subvariant, the page that I already sourced from, and this page, regulatory decision summary for Spikevax XBB 1.5. It's the extent of what Health Canada can share on this review. Again, the page that I already pulled my questions from. You can contact the manufacturer for any follow-up questions. Enjoy the rest of your day, from someone at Media Relations. To which I responded, thank you. Yes, those are in fact the pages that I reviewed to formulate my original questions. To clarify, please confirm if Health Canada is able to answer the following questions. And I repeat, all three of them, very straightforward. And then I ask, if the Federal Health Department responsible for this authorization is not able to answer the above questions, how does this affect the confidence of Canadians in your capabilities and your competency? Sadly, as was the case before, Health Canada did not respond to this further request for clarification. Safe and effective, though. And watch out for this lurking in the shadows, dangerous misinformation of unreliable sources. For Rebel News, I'm Tamara Ugolini. Canadians are grappling with news blackouts on social media due to the Justin Trudeau Liberal government's Bill C-18. This new piece of legislation demands that social media platforms pay the government for news shared by users, which is an inconceivable task for companies like Meta and Google. So, as a result, they have decided to preemptively block all Canadian news content, including ours at Rebel News. In response to this, we have since teamed up with VPN provider Private Internet Access to ensure that you can continue to access all of our content across a broad range of platforms, while also maintaining your privacy. For only $2 a month, you can bypass Trudeau's new censorship laws while you safeguard freedom of speech and continue to get the news that matters to you the most. Visit piavpn.com/rebelnews to take advantage of the 84% discount and 4 months free. As a bonus, PIA has all of its servers located in the United States, not China, and they automatically delete user data from their servers to avoid leaks and government subpoenas for information phishing expeditions. Don't delay. Head over to piavpn.com/rebelnews to stay up to date on the news in Canada and protect your access to it. Don't delay. You don't want to be left behind.